Let's go on to the next type of hematuria, which is basically this one is called the glomerular type of hematuria. Okay, and the glomerular type of hematuria, I think you guys can spot out the word glomerulus from glomerular. So that simply means what? The cause of what? Blood in urine is having to do with the glomerulus. Okay, that's just a rough idea about the whole thing. So talking about this disease condition, I will basically have a definition of it. We're talking about the causes, talking about the characteristics, talking about the possible evaluation, and we'll end up with the management. That's basically the possible treatment for this disease condition. So, everybody knows what hematuria is. Hematuria is basically what you passing out blood in urine. Okay. So, glomerular hematuria refers to what? Blood in urine, okay? And this actually originates from the glomeruli, okay? So that means like the problem is associated with the glomerulus. Do you understand? Now, we said that the tiny blood vessels in the kidney that filter waste and excessive fluid, that's the glomeruli, okay? Inside the glomeruli, you have tiny blood vessels, okay, in the kidney that filter waste and all that, all right? So if the problem is from that unit, that's why we say a glomerular hematuria, okay? So what could be the possible causes? It could be that there was inflammation of the what? Glomeruli. That's what is known as what? Glomerulonephritis. And if there's inflammation, it could affect the blood vessels, okay? It can actually impair their membrane and cause some blood to leak out, all right? Then it could be that there was immunoglobulin A nephropathy, that's the Berger's disease, okay? It could be a membranoproliferative or glomerulonephritis. It could be a focal segmental glomerulosclerosis, all right? It could be a diabetic nephropathy. It could be hypertension. It could be vasculitis. It could be that the blood vessels just got inflamed. Okay, so I'm talking about the characteristics of this disease condition. Uh, there will be presence of red blood cell casts. Okay, there will be dysmorphic red blood cells. That's like you have abnormal shaped red blood cells. Okay, in urine. There will be proteinuria. Do you know why there will be proteinuria? Okay, because most of the times when there's inflammation of blood vessels or inflammation of the glomeruli itself, proteins get filtered through the glomeruli, which on a normal, if the glomeruli is intact, proteins will not be filtered. Do you understand? So that's the reason for that. And this type of hematuria will be maybe persistent or intermittent. Okay. Talking about the possible evaluations, you might want to do urinalysis just to dictate hematuria and proteinuria. You might want to do urine microscopy to examine red blood cell morphology. You might want to do blood tests to assess kidney function and rule out other possible causes of this condition. All right. You might want to do imaging studies like ultrasound, CT scan, just to visualize the kidneys. Okay, just to see how the kidneys are doing. All right. Then you might also want to do kidney biopsy just to confirm your diagnosis. All right. So management. You might want to treat the underlying cause. If there's something that is causing it, okay, you might want to treat it first, okay, like do some immunosuppression therapy for glomerulonephritis, okay. You might want to also control blood pressure and the proteinuria too, right? They also monitor kidney function and urine output. They keep a close eye on the kidney to see that what the disease condition is not progressing. They address related conditions like what diabetes and hypertension. You can also refer the person to a nephrologist just for them to receive what specialized care. All right. So this glomerular hematuria can be a sign of a kidney disease. So prompt evaluation and management are crucial to prevent what progression to kidney failure, because your glomerulus is becoming inflamed, and the glomerulus is basically what that filter part of kidney. So you might not want it to be affected. All right. So guys, that's it about Glomerular Hematuria. See you guys pretty soon.